Anjali, don't go anywhere because we want your input on this next discussion with Dr. Rajeev Fernando, Harvard Medical School Fellow in Disaster Medicine. It's good to have you here. And we want to talk about where we stand with all of this COVID-19 testing and what the CDC is saying. And Doctor, I just want to ask you a question because the government's getting ready to sign a $500 million contract, or a contract rather, to purchase 500 million antigen tests. Have they undercut our faith in these tests by telling us they're not as accurate as we perhaps thought?
Well, thanks for having me on the program. First of all, for starters, there are two ways of looking at this. One is the data we have from a test tube, and then is the data what we have in clinical practice. So a lot of times there's a discordance between that, and I'm hoping this is the case over here. But let's remember, antigen tests are good tests. Usually they're 85% sensitive, but I don't have a crystal ball, and I'm hoping it's around the same percentage. But remember, if you're sick, you have symptoms, and you have a negative antigens test, go the distance and get a PCR test. The PCR test is the gold standard. So don't be fooled by these antigen tests if they come back negative and you have symptoms. Go ahead and get a PCR test, gold standard for diagnosing COVID-19.
Dr. Anjali here. I wonder, you've spent some time in Europe and looking at how they're also dealing with it. What would you say is the one thing that the U.S. could be doing better by comparison to Europe, or even vice versa?
Yeah, some great question there. But one thing which I noticed, which, it may be difficult to enforce in the States, but Germany actually put in a lockdown for the unvaccinated people that really, brought the caseload down. I'm not sure whether we can do something like that in the States, but certainly food for thought. Like, imagine if all the cases you just mentioned the pediatric cases. Also, all of them are unvaccinated, really. Some, of course, they're unfortunate. They're less than 5. They don't have the option of getting vaccinated. We'll have that early 2022. But even the other kids, all are unvaccinated. So what would happen if we were to, severely restrict unvaccinated people? That'll definitely bring the caseload down.
Help us understand the reality on the ground with testing. We keep showing the pictures of the long lines. And that was the rush up to Christmas. I can understand lots of people wanting to get tested before they see their family. But real world experience, the pharmacy around the corner, it's as if they're giving away the rapid antigen test. They got a ton of them. They limit how many you can buy, but they got them. PCR test, no line yesterday, went and got the test at 6:30, got the results back, fortunately, all good, within 24 hours. So what is the reality of testing right now?
Sure. So I'll let you know what I'm seeing on the ground in New York. Severe shortage. People are just waiting. Their antigen tests sometimes are taking a couple of days to come back. Severe. And this is only going to get worse. I'm just waiting on the post-Christmas surge. Should be starting in a couple of days. But it's getting worse. It's a real problem. And I'm eagerly waiting. I know President Biden has promised 500 million tests in January. So I'm eagerly waiting for that. It looks like everything is promising, and he will come through with his promise. But until that happens, it's an absolute disaster. Like we also discussed, the rapid antigen test, the sensitivity is not good. The Omicron strain the symptoms are so mild, it's hard to distinguish whether it's a cold or Omicron. My patients call me and say, well, doc, I think it's the cold. And I said, well, you can't be sure. It's best to check for COVID because knowing is the most important thing. When you know you have COVID, we know that one case can, in my experience, official numbers are not out yet, but in my experience, I think one case that's positive can infect up to 10 people. This is one of the most infectious viral strains I've seen in recent times.
Doctor, I'm so glad you brought up what we're waiting to see really is what that post-Christmas, post-holiday surge might look like. Across the globe, we've seen maybe milder cases. We do struggle with, unvaccinated pockets in the U.S. Do you think that because of the previous waves, kind of like what we saw in South Africa, we might actually be safer, or are you anticipating that we might start seeing more severe disease?
I think we're going to stick with this mild disease. The pain that Americans are going to face over the next few weeks, my assumption is probably up until February or end of January is really going to be the sheer volume of cases. This surge is going to be unlike Delta. Now, Delta, we know, for example, there were different parts of the country, very regional, different parts of the country having surges at different times. But this, I predict, is going to really beat up America as a whole at one time, which is what we're seeing right now. Record number of cases every day. People are going to suffer for the next 4 to 6 weeks, and then it's going to come down. You're going to see increased hospitalizations just based on the sheer volume. I still think we're going to have mild disease. The other thing I've been following in the hospitals over here is the length of stay. The length of stay for a Omicron variant COVID-19 is about 3 days. Far, far less than what we had for Delta. I've seen patients, weeks and weeks, sometimes a month or so. This is much less than that. The immune compromised people may have a different sort of disease. That's about 2 to 3% of Americans. But for the most part, I'm quite confident we'll see mild disease. That's what we recorded in South Africa. We're seeing it around the world. But remember, this virus is always a step ahead of us. So we have to follow very close.
Doctor, understanding that medical ethics require everyone to be treated, but we're seeing the stories about people. There's a 78-year-old man who had sepsis and died because he couldn't get into a hospital bed for a month because of people who were not vaccinated taking up those hospital beds with COVID. Would it be ethically appropriate to set aside a few emergency room beds specifically for people like that 78-year-old? If it's the unvaccinated who are filling up the hospital beds, and keep those beds open because heart attacks still happen and other things still happen to people who are getting vaccinated?
Yeah, that's a great question and food for thought. Definitely, I think that's something we should consider. Sometimes it's hard. I have my junior doctors who work with me, and sometimes it's hard. They say, well, he's vaccinated. Well, that's what he gets. I'm like, no, that's not the way. In medicine, we practice whatever the situation, they're here in our hands, and it's our job to save their lives. So we're 100% behind all our people. Of course, I understand it's hurtful that unvaccinated people, they should take more responsibility. But when they're there at our hospital, we don't spare anything. We go for it all the time, and we need to save lives. But I love your comment, your thought over there. We should start thinking about this. Remember, when you have surge capacity, hospital administrators, when they're planning for surge capacity, which is double their beds, they should think about this as well, because heart attacks are happening, strokes are happening, and this should not be the situation. Sepsis kills in hours. We have to treat them early.
Doctor, I know that you were also in Wuhan late in 2019 when this virus first broke out. We're hearing reports now of some cities in China locking down once again, even though we're looking at Omicron being milder and really everywhere else we haven't seen as much. Are you surprised by this news and what do you think sort of the impact could be?
Yeah, unfortunately, I'm not surprised. This is a draconian policy by China, and they strive to have a zero COVID policy. Now, putting that in perspective, we have more than 250,000 infections at this point a day. To put that in perspective with China, where they just don't want to have any cases at all, that's going to be really difficult. Once again, millions of people are under a draconian lockdown, and it's upsetting to hear. The industry, we really also, like I mentioned here, we have to think of life and virility as well. People who can't work are not going to be able to make money. Lots of suffering aside for them. So is it really worth it? And striving for a zero COVID policy, in my opinion, is not possible. We're going to, as this goes on, COVID-19 is going to become endemic in the world. We're going to accept it. We're going to say, well, you have COVID-19, stay out of work for 5 days. So it's going to become endemic. And, in about 15, 20 years, COVID-19 will be the cause of a common cold. That's what we're heading for. That's the reality. So I politely and respectfully disagree with the Chinese government on what they're doing right now, putting a lot of people in pain over there.
Dr. Rajeev Fernando, Harvard Medical School Fellow in Disaster Medicine, thank you so much for joining us, and have a happy, healthy new year. Angelique Kamlani, we look forward to your reports, especially as we still work our way through this pandemic.